An infectious disease specialist, Dr. John Brownstein, joins me now for more on this. Dr. Brownstein, experts are saying that the U.S. is on track for more than 200,000 cases a day. What does that tell you about where we are in the fight against this virus?
Yeah, hi, Diane. Unfortunately, I think we're in the worst position that we've been in and really losing this fight against this virus heading into the winter. And I know people are going to talk about, okay, this is testing, but it's not about testing. We have 62,000 people in hospitals right now due to COVID. States are reporting their highest numbers. The Midwest right now has far surpassed the Sun Belt rates, and deaths are increasing, right? So we're seeing a high 7-day average, over 1,000 people are dying every day. So we're in the worst period of this pandemic ever since the surge in the Northeast. And so, yes, we've had advances in care, but we're going to get a really challenging few months. And so now is, again, the time, the things that we keep saying: mask wearing, social distancing, limited indoor gathering, continued testing. You know, there's vaccine positive news, but that's not going to come in time to help with this current surge.
Yeah, we were just looking at the graphics right now showing the number of cases as they come in. And I'm curious, and I know this is just semantics, but are we in a second wave? Are we in a third wave? Are we still in the first wave? What do you think?
Yeah, I know this is a question that keeps coming up, and a lot of our colleagues have this conversation because we never got back to baseline. We just keep increasing. We come down in cases but come back up. So technically, we could still be in this first wave. Some parts of this country are seeing their first major surge. So it's challenging to define it, but regardless of whether it's 1, 2, or 3, it's a massive surge that we have to take so seriously.
Does that definition matter in terms of how you approach it, either from a public health standpoint or from an individual standpoint?
I don't think it really should change anything. I know we like to bucket things into surges, but the reality is it's about the numbers of cases happening. It's about where we are in terms of herd immunity, which we're still far away from. It's about protecting yourself and your community. So all the same things hold true, masking and social distancing. It doesn't really matter. If rates are really high in the community, you're at risk and your family is at risk. And that's really all that matters.
So right now in some areas, we're seeing patients treated in overflow tents, COVID positive medical workers staying on the job in some areas because hospitals are so overwhelmed. How does that affect quality of care?
Yeah, I'm so worried about quality of care right now. So, the numbers of patients are climbing. What we're seeing is shortages in nurses and medical professionals. And so even if you add more beds, if you don't have the professionals to take care of these patients, it doesn't really matter. And, many of these places around the country already had shortages. So you add COVID on top of it, it's going to be really challenging to fill in those roles. And if you have an entire country lighting up with COVID, you can't sort of move people around the country to fill in. On top of that, we have PPE shortages. And so regardless of all these new protocols and treatments, if we just don't have the capacity to treat patients, we're going to have to triage them, and we're likely going to lose a lot of lives.
Now, the CDC just came out with these new guidelines for Thanksgiving that we heard Matt referring to. They're saying the safest option is celebrating only with people in your household. But if you do celebrate with others, take precautions like wearing masks, keep your distance. What's your advice to people questioning whether they can visit friends and family for the holidays?
Yeah, this is a really challenging one. Of course, we want to spend time with our family, but we don't want Thanksgiving to be this massive single-day super spreading event. We know how bad things are. It could make things incredibly more worse. So really think carefully about what you want to do. Try to stay with your household. If you're trying to see others, apply the 14-day quarantining, mask wearing, social distancing. The lowest risk activities are really small gatherings of your household, virtual, Dr. Fauci is doing a virtual Thanksgiving, right? Trying to stay home, do the shopping online, watch TV, The medium sort of risk activities are trying to stay outside. We've known since, for many months that staying outside interactions can limit transmission. But the high risk activities are ones that we really want to avoid, right? Large indoor gatherings, shopping in crowded stores, spectator sports and parades. Really got to stay away from those things if we're not going to turn Thanksgiving into a real nightmare, unfortunately.
It seems like the big one is that family meal. How practical is it? You can wear masks during, obviously, the whole event, but when you're sitting down and eating at the table, that's not going to work. So how practical are measures like opening the windows and maybe sitting separated among the table by household, where you're at one end and, your parents are at the other, kind of a thing?
Yeah, I mean, listen, anything that you can do to create some social distance is good. We know that some level of ventilation actually really does help. So opening a window, it may seem silly, but it does actually help. And of course, we do have testing available too. If you are coming and you need to see your parents, I mean, you should consider quarantining for a week. You should try to get a test within a few days of going to see the family. I mean, those things are still available and highly recommended. So, you know, it's a layered approach. It's not one thing, but if you can layer in all these different interventions, you could probably have somewhat of a safe Thanksgiving meal.
All right, Dr. John Brownstein, we appreciate the advice. Thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.